Hello, I'm Douglas Richmond. I'm a professor at the University of California, San Diego, director of the Center for AIDS Research, and a physician at the San Diego VA healthcare system. It's now 30 years since the first cases of AIDS were recognized, and things have changed dramatically since that time. At that time, we thought it was a small epidemic in gay men, and over the period of a few years we realized it was a global pandemic affecting all aspects of society. Since that time, 75 million people have been infected, half of whom have died of AIDS. But the exciting and encouraging thing is we have made a truly dramatic impact on the epidemic. The development of antiretroviral drugs has basically turned what was a death sentence into a manageable chronic condition. And patients who can adhere to their regimens are doing well, and it's the management of HIV has perhaps a better prognosis than someone who presents with diabetes or high blood pressure. What's also very encouraging is with multiple efforts, including the PEPFAR program of the United States, the expansion of access to antiretroviral drugs has now treated over 7 million people globally, the majority of whom are in resource-limited countries, where the majority of cases are occurring. There's still a lot more to be done, but the impact on survival, and now I think an impact on transmission, because treated people are much less infectious, is quite impressive. Preventive measures have been successful, especially in mother-to-child transmission with treatment. And now with greater saturation of the infected population, there's evidence that transmission is being diminished in the population as a whole. There's still a lot to be done because people are still at risk, and often precautions that can prevent infection are not practiced or accepted satisfactorily. And the prospect for prevention with a vaccine is a long way off, probably at least a decade. One of the great accomplishments of modern medicine has been development of antiretroviral treatment, but over the centuries, the development of vaccines for viruses has been a great accomplishment. Smallpox, measles, polio, and so on. But all of the approaches to prevent infection with viral vaccines have not worked for HIV as a vaccine. And so we need new approaches and research to accomplish that. And in the meantime, preventive measures are limited pretty much to behavioral interventions and more extensive treatment.